Barb, you can bring Mama into the library.
Okay, as support, as the therapy animals.
Yes, I'm going to turn off my video because I have not combed my hair yet.
Let's see your dog, John.
We need to see Zeus first.
Yeah, let's see your dog.
Come here. Let me see. Where is he?
There he comes. He's very sweet.
Yeah. All right, enough of that. My camera's going off now.
Come on, John.
Hi.
Hey, Richard.
Hi there.
All right, well, we'll get started. It's 9:01, and I hate to start late. So thank you, everybody, for joining the call today. So as I said, if you were on the April 2nd call, I'm just trying to have these calls as a forum for nonprofits, for you all to
Just got started.
talk to each other and share ideas and share concerns and encourage and support one another and share resources as well. I will start by giving you the obligatory apology for kids and cats, and potentially wife. Heavens knows if anybody will come on. So I wanted to just start by letting you know, if you don't know, that the second installment of the Paycheck Protection Program was approved by the House yesterday, which is good news. It's just waiting for the president's signature. So what I'm not sure about is if you need to submit a second application for it, or if your first application will suffice. I'm hoping it's the former. I don't know if there's anybody of our banker friends on today who can provide a little insight on that, but we'll hopefully get a little more on that as we go forward. Has anybody gotten their Paycheck Protection Program loan?
Yeah, we did a Blue.
I have.
Yeah, we did a Blue Ridge too.
Okay, great.
And at Sinclair Health Clinic.
Excellent.
I did Blue Ridge.
Plantation.
Okay, that's great. I'm very pleased to hear that some people got that. I haven't gotten mine yet, so I'm just waiting. But I know it's going to the SBA, so that's good. So when I looked at the registration forms the last couple of days that have been rolling in, I can't help noticing that a lot of people said they were doing well under the circumstances, which is really good. I'm pleased to hear that. The funding is, one of the big concerns, obviously, that's going on. And I know from a donation standpoint, it's very difficult now, people's economic situations. And I suspect also money going to, so-called frontline nonprofits at this point that are more visible in this situation, but that's conjecture. I'm not 100% sure about that. I did post some additional resources. I have a couple of really good websites that have a lot of practical tools on them. So a lot of what we've seen so far about resources is about accessing loans and that type of stuff. So these websites that I posted on nansv.org on the resources page, and I'll put that in the comment box also, are practical, and they provide templates and resources for employee surveys to take the pulse of your employees as this is going forward, which I think is a really good idea to make sure they feel supported and address any concerns that they might have. This is kind of an unprecedented time, obviously. There are templates for contingency plans up there, which I also think is a very smart thing to do, so you can monitor the situation and make informed decisions and well thought out strategic decisions on what to do as things change, when to reopen, what happens if this goes on 9 months, what happens if it goes on 18 months, what do we do, what does it look like when we reopen. All of those things are important to think ahead about. And as I said, there are some really good websites that I've put up on nansv.org, and I'll send out a summary of this call as well, so that everyone has access to them. So I guess I wanted to just hear from you, for the people who said they're doing well right now, what's happening? What are you doing that's kind of giving you a positive situation that's helping you through this. And please feel free to raise hands on here because I can't see everybody, but you can raise your hand to make a comment.
Well,
Go ahead, please.
okay. Hi, I'm Melanie Molinex, and I work at Samuel's Public Library as the development administrator. And I actually just started there on March 30th, right in the middle of all this COVID-19. So it's been a really weird way to start a new development job. But I think what's positive for me is that we're still able to provide some services to our patrons. We've, added some new resources that people can access online. We've had, we're offering like our reference services that people can call in and get information. And we're even doing like comfort calls to our patrons. So I guess what's helping me and the other staff through all this is we're still able to, do certain things to serve our patrons. And I guess that makes us feel like a little bit better when we're, trying to work through all this. We haven't completely shut down, even though people can't come to the library, they can't check out books. There's still other things that we can do to, keep our services going.
Great. How are you using your volunteers? How are you keeping your volunteers engaged during this?
Well, that's a really great question. And that is really challenging right now. I mean, we've been trying to reach out to our volunteers, with comfort calls and just checking in on them to see how they're doing. But we of course we can't have, volunteers in our building right now. And I mean, there is concern about that for when we do open up and we do, we're open up to the public again. We rely a lot on volunteers, and I'd love to hear from other people if they also are a volunteer organization, what they're doing, because that is a real great question and a real challenge right now.
Sure, it definitely is. Karen Poff, you have your hand up. And or on mute.
Yeah, it took me a minute to mute myself. Unmute myself, sorry. And I would really echo what Melanie said, that what is enabling me to function well is the ability to work. And I feel really blessed that even though our office is closed to the public, I'm still able to come to work every day. I'm isolated because I'm the only one here. My coworkers are teleworking, and so I've still been able to do a lot to help people. I'm answering questions. And for those of you who don't know me, I teach personal finance and money management. So I've been able to answer people's individual questions. And I'm working on I've done a podcast on the economic impact payments on the River 95. I've been working on a webinar called Managing the Money Crunch, to help people be able to, get through, basically. A crash course in personal finances that's just an hour, that'll be a live Zoom. I'm hoping to start that next, not this coming Monday, but the next Monday is my plan to start that. And at this point, I'm not positive, but I'm thinking of holding it 9 a.m. and 1 p.m. and don't hold me to the times because that might change, but every day, making it available, but people have to register. And then that way, if someone's registered, we'll have it. If no one's registered, we won't have that one. As far as involving volunteers, once that goes well, if we have people registering and we have a demand for it, then if I have volunteers who feel like they could do it on Zoom, I'll involve them in teaching. Some of my volunteers have more technical savvy than others, so that's probably not gonna bring in everybody, but that'll be a start. The other thing I'm considering, and I'd love to have feedback about this. I know there's a lot of people who do not have technology access, or their technology access is very difficult, as far as, it's hard to participate in a Zoom webinar from a phone. for example. So I'm considering telephone classes. And what that would be is sort of a one-on-one mentoring session, but I don't feel like, I feel like people need the quick answers versus what you would consider financial mentoring at this time, because there's too much uncertainty for them to make real solid decisions for the long term. So what I'm thinking of, this managing in a money crunch webinar could be taught individually by phone. Again, by the volunteers, if I can figure out a way to structure it. And I guess that's, anybody's feedback on how that could work effectively would be great, because I want to reach out to the people who need the information but can't come to a webinar. And it would be the same thing. There would be, the script that people would have used for a Zoom. They would talk through that script with the person on the phone and then refer them to appropriate resources for more individual assistance. So let me know what y'all are thinking, not necessarily now, but at some point, any feedback is appreciated. I'm going to put my email in the chat box, and that way, if you have other feedback, you can shoot me an email as well. Thanks.
Awesome. Thank you. Sarah Schoonover-Martin has her hand up.
Hi, good morning, Tom. Yeah, I'm the director for Healthy Families, Northern Shenandoah Valley. And I know it's such a stressful time for everyone. We are just trying to, connect with our staff on a daily basis to try and ask them, just a daily check-in. How are you doing? How can we support you? Try and send them words of encouragement. We stopped services on the 12th in the homes, and we switched over to the telehealth platform on the 18th. So we have been so busy trying to get, just a Zoom call, like the basics. We switched over to doxy.me, but trying to get everybody up and running, and even infrastructure. I was able to reroute one of my grants for emergency COVID funding so that we could order some iPads to help support the team so they can connect with their families. So just trying to think differently, and then even long term, I feel like we need the infrastructure now, because I don't feel like it's going to be just a 30, 60, 90 days. I think we're looking at 12 to 18 months, and if it loosens up and then goes back, how are we going to ensure that we can still serve our families? So just brainstorming and thinking outside of the box. So that's taken a lot of time. And then we were thankful we got the award or one of the grants from United Way of Northern Shenandoah Valley for diapers, wipes, and formula. So the order for those items were placed yesterday. For all of our partner agencies, we will be announcing the date and time and location for the event. And so we met with all of our partner agencies on the 15th via a Zoom call, and they're trying to identify the highest need families in the community. But certainly if anyone on the call, if they identify any high need families, please send me an email and let me know, and I will send off the, basically it's just word of mouth, and it's up to the partner agencies in the community to identify the families and send them for what they need. We're going to do a drive-through diaper distribution, hopefully in the next week to week and a half.
Great. That sounds really good. I do wonder, for some of you out there, I was talking to somebody yesterday who went to remote workforce, but lacks the technology, lacks the laptops and the basic technology to telework effectively. So I'm wondering if that's something any of you are running into too. But Kim, go ahead. You have your hand up for a while.
Thanks, Tom. And thanks for putting this together. I think it's helpful for us to just all, stay connected. As difficult as all of this has been, was it yesterday? I think it was yesterday or the day before, we actually had a house closing. So The work continues, which is great. The other thing I think that it certainly keeps me going during this process, and it's some of what other people have said, really staying connected with staff and figuring out creative ways to do things that we've done in ways that things have been done in the past. So that's really exciting. And the other thing is, I was on a Zoom call yesterday, and it was through a session that was put on by the Nonprofit Quarterly, and it was focusing on HR kind of through this COVID-19 time. I don't know if anybody else had the opportunity to join in on that, but and I've been on other Zoom calls, and I just have to say that as challenging and difficult as this time has been, the call yesterday was just so full of amazing thinking, creative ideas on how do we go forward from here. And I just think that we are all going to be so much better and stronger as organizations and as a sector in trying to deal with how do we deal with this issue of we don't have technology, or how do we deal with this issue of not being able to provide direct service to our clients or our customers. And so I mean that is really exciting to me. And again, the call yesterday, I mean, one of the nonprofits was talking about how they have unlimited vacation time, and just the thought of that was just kind of like, wow. Like at first I was like, how do you do that? And then I was thinking, gosh, if you had that, you probably set this whole tone in your organization that would be a really different feel and approach. And I was like, wow, I wonder what that would be like. And so I think it's, allowing all of us to kind of wrestle with how the norm has always been, or, whatever's worked for your organization, and kind of push back on that some. And, that call yesterday was really focusing on equity and inclusion, and making sure that we're, treating humans with respect. And I mean, it was amazing. And there's been other calls over the last couple of weeks that I've been on that are very similar. And I just think that COVID-19 is kind of pushing us all to really challenge our thoughts, and to look at different ways of doing things. The other thing I'll just mention is the Nonprofit Alliance Steering Committee did meet. And one of the things that as those of you who've been around for a while know, we do an every other month lunch and learn. And we're interested in topics that people might have for a monthly lunch and learn, recognizing that now is a very challenging time. So if there are specific topics that are kind of, jumping out for you that are really relevant right now, if you can kind of share those. And then Tom's part of the steering committee, and we're all going to be working together to kind of get the nonprofit sector as much information out, either through the website or through these Zoom calls, just so that we're all feeling supported.
That's great. Thank you, Kim. And I agree, there's a huge silver lining in all of this. And that is that it's challenging thinking, challenging our services, and challenging the way our workforce interacts with us too. So I think that's really great. I think that has a lot of potential for the future. As challenging as this is obviously a difficult situation, but I think there's a lot of good that can come out of it as well. And that's one way too, I think, to engage your volunteers a little bit, and maybe engage your employees that aren't necessarily doing the same things that they were doing before. Is if you have things that you've wanted to get done for a long period of time, whether it's related to donor management or anything else, any initiatives that you had on the back burner for a long time, now is potentially an opportunity to deal with some of those stuff, whether it's giving those to employees who have a little extra time, or even trying to engage some of your best volunteers to maybe look at certain things. I think that's a potentially good way to involve people. I'm going to go to Barbara. You've had your hand up for a while, so thank you for being patient.
You're welcome. I'm with the Friends of Handley Regional Library, and the volunteers are absolutely critical to the success of what the Friends can do for our library system. And conveniently, this was National Library Week, so I was able to reach out to the key volunteers and some of our key community partners and ask them for why the library is important to them. And we could post those on our Facebook page, either text or they could record it. Everybody's very comfortable, most people are comfortable recording, a 4 or 5 sentence testimonial to a library system. So I was really glad, instead of just updating them with information, we could ask for their opinions as well as their support. So that felt good for me, and I've enjoyed seeing what the community members have put together for us.
Awesome.
So that's that.
Thank you. Richard, who's in outer space.
Yeah. Sometimes I feel like I'm in outer space. Who knows? Now, I just wanted to say a few things here. First, I want to give kudos to Kim Herbstritt. She communicated with me. They're opening up. Kim, are you opening up the Restore, or is that going to happen soon?
Yeah, we did a soft opening on Tuesday, so
Okay.
we are open.
Good. Well, we're thinking maybe middle of May or so, something like that. However, for our thrift stores. But the main thing here I want to say is thank you very much for sharing some of your items that you have in the store that you might not be able to sell or something like that. And I just want to say to everybody here that Kim reached out to me and said, hey, I've got some things here that we might not be able to sell, and that could you use it in your thrift stores? And we said, yeah, sure, we can do that. And I don't know if Angie has gotten back in touch with you yet or not. So, but I very much appreciate that. And that's just a sample of what we can do as sharing between the nonprofits. If there's something somebody needs, and maybe and you can use it or something like that, then you just please do share that. Just a couple of things. Our organization, we have over 220 people that work for us. And we have to, I'm always looking at ways to keep the staff pumped up and so forth, and doing what we can to keep them in the spirit and so forth. One of the things that we just recently, in fact, we're going to be doing it on Monday, is that we put together these little signs, kind of like the sign, the candidate signs, politician sign you can stick in the ground and so forth. But we have it as, we're going to put out signs in each person's home that says hospice hero. All of our employees will have a sign in their front yard saying they are the hospice hero, doing that. So we think it's a way to help recognize their efforts that they do for that. So that will be going out Monday. We also, we have, you're probably aware that we have chaplains and music therapists and so forth. What we do each day is that our manager of that bereavement group puts out to the whole staff either something from the chaplain or a music piece from the music therapy person and so forth. And anybody can either request particular songs and so forth, but it's set up where it goes out through our email, and anybody can play that during the day. And we do this every single day on there to help keep people in the spirit and doing that to keep them going. And then also you may have saw in the Star recently here, we have a telehealth program that we started last week or so for all of our patients. We have over 216 patients through the number of counties and so forth that we have here. And so we, obviously a lot of them are in the facilities where we can't go into except by a doctor or by the nurses and so forth. So how we keep in touch with them is that we are actually doing a telecommunication where they can use their own system and tie into ours, or we're also in the process of distributing tablets to all of our patients so that they can also communicate to us and be able to do that. And fortunately, Medicare has allowed payment for telehealth visits. So that really has helped us quite a bit, which is something that was never been done before. We're hoping that will carry forward once we get through the virus period here, that we can continue doing that. So anyway, Charlotte, yes, I'm with Blue Ridge Hospice. I've been there as the interim CEO since last August. And because of this situation, I think I probably will be there a little bit longer until they can get back with the search on here. So, no, it is a challenge every day to keep all the spirits up and everything. And so we're really grateful for the health care people that we have. And you know, we just doing everything we can, particularly the senior leadership team here, to keep them up with doing everything we have. So thank you.
Hey, Richard or Kim or anybody that has a thrift store, are you guys taking donations from the general public right now or no? For kind of like clothing and stuff.
I can share that. Blue Ridge Habitat, our Restore, we're actually considered an essential business because we're home improvement and construction. But we did close to the public, both the office and the Restore, on March 20th. And that was, that was driven out of concern for, you know, safety and the health of everyone. But, you know, we also take a lot of our direction from Habitat International, and that was their kind of direction. So we did close. As you and Richard knows, you know, every day that our Restore is closed is revenue that will ultimately build houses for people, so affordable houses. So we've been working hard to implement policies and procedures to align with the CDC and the VDH guidelines. And so we are having, as I said, we had a soft opening on Tuesday. We're going to have the official opening this next Tuesday. We haven't been taking donations per se this week, but we will start taking donations. We have not started our pickup of donations yet. That's partially driven based on we've got very limited staff right now because of staff we've had to lay off. And we don't want to bring volunteers back yet. So we're still working through the logistics on that. But, you know, donations are, you know, part of what generates the revenue that we have. And so we do want to, as quickly as possible, get back out and start picking up donations, but certainly allowing people to drop off donations. So we're proceeding with caution. We're going to have a process in place where things are going to get wiped down and cleaned as best as possible. All of our couches get sanitized. And so there's things in place that we've implemented. Some of those things have already been in place, but really making sure that all of our stuff is safe for people to come and purchase.
Tom, I can tell you what's going on with the Blue Ridge thrift stores. What we did is we closed the stores a few weeks ago, but we kept the staff on because we wanted to clean up the stores and get them ready for when we do open up here. We repainted some of the stores and just redisplayed a lot of things and done that. Now, what we've done in terms of donations, on our website, you'll find that you can drop off donations we have a couple of locations. We closed down a couple of locations. We just have a few where you can actually drop off items. We have a truck where you put the items into a truck and then it stays there for a day before we then take care of it. But also we'll go out and pick up your donations. We have a phone number to call for donations. We will go out, we will tell you where to put the items that we are picking up, and we'll set up a time with you and go out and actually pick up those donations. And then the other thing that we've done, since we don't have the stores open, we started online sales. We've actually go through eBay and a couple of other sources here we photograph our items, put them on the online there for sale. And then we make arrangements. If you wanted to buy it, then we make arrangements to get that item to you after you've purchased it. And as I said before, we hope, we don't know yet, we're going to follow and see what happens, but we're hoping to open the thrift stores about mid-May is kind of what we're looking like right now. So anyway, that's our status.
Great, thank you. That's awesome that you're doing an online store. I love that, or online sales.
Yeah.
That's a great idea. John Huddy, you've been waiting for a while. How are you today?
Get his hair combed? No.
I don't know. He's on mute. There we go.
No, I'm not on. I just wanted to say that we're all closed, and we're probably in the next week or couple of weeks, we're going to start opening up the drops so people can return materials, and then we can process those because we have to quarantine them for a day or two and then put them back on the shelves. And then we're going to go to curbside service after that. And we're buying sneeze guards and stuff and all this to sort of handle the public because we are a medium risk facility according to the CDC. Anywho, one of the things we are going to do, which you can look forward to if you know anybody who needs internet access, is my staff is identifying some locations in the city at schools that don't currently have Wi-Fi to the exterior, and we're going to have a van with a hotspot and park in the parking lot. And then if students or anybody who needs to do anything, they can go in and pull up next to it, and we'll show them the passport on a giant piece of paper, and they can log in. So look forward to that if you'd like. But we're going to try to get back up to business sometime in the next, by June, hopefully, at least in some limited fashion. But we've got to take some steps right now to ensure public safety so that we don't become a public health hazard with everybody milling together. I listened to a talk by the guy who does bar rescue, and he yells at everybody, which is an entertaining show. But one of the things he said is that institutions who are obviously making strong attempts to ensure public safety will succeed. So we took that to heart, and we're going to look into making sure that when you come into the library, it'll look different, and that you'll know that we're taking care of your safety. But that's essentially it, and we'll get the books back out to the public soon. So look forward to that.
Great, thanks, John. Karen, you still have your hand up. I'm not sure if you had something more or if you just left it up.
Well, I guess a little bit of both. I accidentally didn't drop it, but I was also putting in the chat box that if anyone, a lot of you have mentioned good programs. If you guys could put those in the chat box and with your contact information, anything that you're doing like related especially to the crisis, then that would be a way that we could capture those to add them to our resource lists so that when we're referring people, we'll know the current information where we can send people. Because, I've got our normal resource lists, but for those, I don't always know who is still operating, who is operating to what capacity, how, so I don't want to send somebody to an organization that's still closed or whatever. So just current information in the chat, I think would be helpful to everybody probably. Thanks.
Awesome, thank you. You can also email me this stuff, and I'll make sure that it gets out in the summary of the call. So if you want to send any resources or any information, by all means, send it to me and I'll get it out as well. I'll put my email in the chat box as well. So that's great. So I don't have any more hands up at the moment. What do you guys need? What could help you at this point? As a nonprofit consultant, I am trying to figure out how I can be of use to nonprofits and keep them running and operating. So, what do you guys need that would be helpful to you to, continue to move forward? All right, looks like nothing, which is excellent. Okay.
The vaccine, of course. Yeah.
Yeah.
I sometimes you don't know what you don't know. That's the issue sometimes.
Yeah, that's true. That is very true. One thing that I'm considering doing, and I know a few others have done this in different areas, is putting together a series of short, practical considerations for dealing with COVID-19 and the situation in it. And I'm wondering how many of you or what the level of interest would be for something like that. I have posted on my website, and I'll put the link down there in the chat box as well, a kind of concept for what these sessions would look like. And I would love it if some of you would go to that document and just provide me feedback on the topics that are in there, the descriptions of the sessions or whatever else. I'd like to make this as useful as possible to people and like to continue supporting the community. But I want to make sure that the effort that I'm putting into it is going to be worthwhile to nonprofits too, and not something that I'm just doing for high entertainment. You know what I mean? So I'll put my website in there, and the link is below the button that says COVID-19 resources, if you're able to go to it.
Well,
Sorry, go ahead, Richard. You can go first.
I was just going to say, I think the biggest help thing for all of us is to be able to share what's going on in the community in here. And I'm not exactly sure how the best way to do that is, but each one of us has, our own events and things going on. But I think a forum of some sort that we can share what each other is doing, I think would really help out. We were in our steering committee on Tuesday, and we were talking about things and said, oh yeah, Tom's already kind of doing this and that sort of thing. So this is the thing I think we don't want to just to do something that nobody else is already doing and that sort of thing. But we don't know that until we begin to share the ideas and the ways that we're doing things on here. So if there was a way to, we could tap into a resource that says, oh yeah, this person's doing that, or this one's doing that, or something like that, and they're willing to share, then I think that's I think the big thing for a lot of people.
Okay, great. Kim.
So just a couple of thoughts. One, I know we were talking quite a bit about volunteers, and I posted it in the chat, but just so everybody knows that this is National Volunteer Week. So let's give lots of kudos to our amazing volunteers. The other thing is, I know we've had conversations here internally and at Blue Ridge Habitat, and I know I've talked with other nonprofits, and this has also been a topic with the steering committee in our recent meeting is, in this new time, how do we manage donors? How do we need to understand donors? It seems like that there's definitely a focus on addressing and funding to address the needs right now, but this is going to go on 3 months, 6 months, a year, potentially 2 years. And I know certainly for us, when we look at housing, there's concern, are people going to eventually go into foreclosure? And, I think that is a topic that we've talked about, and I just would be interested in what other people's thoughts are. I mean, do you feel comfortable and confident based on the world as we know it now, or beginning to know it, that you know how to approach and talk to donors, or is that an area that you feel like you could benefit from more information?
Chuck, can you comment? Chuck from Eastern Long Island is on with us this morning. So.
Good morning, gang, and it's a pleasure to be here. Thank you, Tom, for inviting me. I'm really pleased to hear about all the communications that you are doing with your staff, with your volunteers. And Kim, you need to do that also with your donors. Don't be afraid of contacting your donors at this point. Well, we took a look back, what was it, 12 years ago with that great recession that we had with the financial collapse and the mortgage collapse. Donations did not go down by very, very much during that time. We were all scared about contacting our donors. Don't be. It's most important that you continue to contact them and contact them directly. I think, Ken, you said, not Ken, sorry. A couple of the stories that I heard about cleaning out house and wiping down things and repainting, all of those things are good stories that your donors need to hear. Most donors, of course, the fringe donors, you might lose some of those. But as Tom said, this is a good time to stand back and take a look at your donor base. And as you look at that, and you don't have to be very sophisticated to see that there are trends of how donors donate. And if you've got a donor that's giving on an annual basis, biannual, even quarterly basis, those are your best donors no matter how much they're giving. Those are the donors you need to concentrate on with your stories. And at the same time, you can ask them to help with some very specific things. If there was a $250 worth of paint that you needed to get your things done, that's something you can directly appeal to a donor to help fund. I've said enough. I'm around for any other comments or questions.
Thank you, Chuck. That's great. Kim, did you have a response to that because you still have your hand up, or just forget to take it down? No, it's no longer up. Okay.
Okay. I'd have a comment on there. We have a lot of donors for Blue Ridge Hospice, but what we've done is we've created a monthly newsletter that goes out to the donors, let them kind of know what's going on with things right now. But you may or may not be aware, but we have the Giving Tuesday now, which is actually going to be recognized on May 5th. And what we've done is we've created a matching program. We're canvassing everybody that we can for the donor side, but our board has actually is going to be matching up to a certain dollar amount for all the donations that do come in to try and do that. So we've done that. We also have intensified our personal contact program between myself and other senior team members that we have to keep everybody informed as to what's going on. And we've actually, our donations have gone up substantially in the last couple of months here because of some of the programs that we've implemented here too. So that's some of the things that we've been doing.
Thank you. So there's been some really good discussion here, I think, today. I'm not one to keep meetings going for the sake of keeping meetings going. So I'll ask if anyone has any more comments before closing this. I think this is, very good to have you all on here talking and getting, suggestions and support from one another. Again, I would appreciate it if you would take a look at the link that I've put up on my website. I've put it in the chat box. And I've also been recording this conversation. So perhaps John is happy that he wasn't on screen. I don't know. I don't know how the recording works, but we'll find out. And I will send out a summary of the call to hopefully later today, but no later than over the weekend. So Tricia, you have something?
Yeah, I just wanted to mention to folks that the Sinclair Health Clinic does remain open. One of us asked earlier and said it would be good if they're trying to refer people to know who is open and who isn't. And the Sinclair Health Clinic has been open through the entire pandemic. This is the time that our patients need us, of course, more than ever. Of course, our way of doing business has changed considerably. People cannot get past the front door without first being checked and masked to make sure that they don't have any current symptoms. And if they do, then they're sent for testing. But we are still serving patients every day. We have moved to some telehealth visits, so there are fewer coming in each day, but of course we do have a pharmacy. It still remains open and our patients really need the pharmacy. So if any of your clients out there have Medicaid or are eligible for Medicaid funding, we would be happy to help them. And even if they're not sure what they might be eligible for, if they give us a call or they stop in, I think we'd be happy to screen them. Before I forget, I want to give a shout out. You said that one good thing that's come out of this is bringing us together. I want to say hi to Melanie, the first person who was
Just send you a message. Hi.
because we haven't seen each other for years.
I know. I was just sending you a private message.
So thank you so much for bringing us together. Melanie might not have known who Tricia Simpson was.
I know. I was trying to figure that out. Sorry, guys.
Okay. I do want to say that one thing that we did do for our staff, because of course they could be very prone to be exposed to folks with the virus, and of course they're all well protected with PPE, but our board did send them a huge Mission Barbecue lunch the other day just to celebrate them and say thank you. And I want to say I love the idea of the Hospice Hero signs, and I'm going to check and see if we can't do something like that for our staff members as well. We did get the PPP funding, which has really been a big help for us. We don't have many of our volunteers coming in right now, but we actually do. Some of our key players, such as our medical director, is a volunteer. So of course that's still in place. But my main purpose was to let you know that we're still up and running. We did lose a couple of staff, but we do have enough staff to cover all the needs that our folks have right now. So if you have people that need us, please send them to the Sinclair Health Clinic. It's been a pleasure to be online today with everyone.
Thanks, Tricia.
Thank you.
Anyone else have any comments or questions or needs? I'm going to keep holding these calls until no one else shows up. I'll probably do them, try to do them weekly, but enough people have said that they're useful that I will definitely try to keep them going. So I hope you will come to the next one to be scheduled. And I'll put out a note about that shortly. But I really appreciate everyone coming on here. If nobody else has anything, questions or anything, I will let everyone go. As I said, no reason to keep it going for an hour if we don't. So thank you so much. And like I said, I will put out a summary of this to the people that were on the call, and I've also recorded it, and I'll post that on my website, and I'll just let you know where that is. All right. So
Thank you, Tom.
all right. Take care. Have a great day.
Thank you.
Thank
Bye,
you.
everyone.
Bye.